OK, we talked a lot at the top of the program about the statewide lockdown in Victoria. A lot of speculation in the media and politics that the lockdown will be extended beyond 7 days. Let's find out what should happen. Welcome again, Professor Peter Collignon, joining us from Canberra. Good to talk to you again, Peter. What's your view, given the data we're seeing coming out of Melbourne at the moment?
Well, so far, it's actually reassuring in that nearly all the cases they're finding are known contacts of people who've already had infection. In other words, most, if not nearly all, or most should already be in isolation. And so not really a threat to other people. Their family might be a threat because they're in their same house, but really contained. So what we're expecting, if you have good contact tracing, which appears to be the case, at least they've found all these people. So unless we find a lot of unlinked cases, these mystery cases in the community, they're the real worry, because it means it's out in the community and you don't know how it's got there. And for every one case you've found, there's another one you haven't found yet. But other than that healthcare worker who, the 50-year-old female healthcare worker in the nursing home, that really seems to be the only unlinked case yet where they haven't tracked it down how she's got it. Otherwise, they've all been linked, which is reassuring. And the really good news for regional Victoria, they haven't found any cases. So at the very least, regional Victoria should be in a position to say, well, there doesn't appear to be any circulation of the virus here. So at least they may have less restrictions than whatever happens in Melbourne over the next few days.
So perhaps time for the Victorian authorities to recognise their systems are working and get rid of the lockdown and keep dealing with it through the isolated cases. Just on the aged care sector, we know in the ideal world everybody in the aged care sector would be vaccinated and everybody who works and attends those sites. But given the high levels of vaccination at the moment of the patients, the residents, we should be quite comforted, shouldn't we, at the moment, compared to where we were last year, certainly.
Well, we're in a much better position than this time last year, where nobody was protected, basically. Now, I'd like to see 90% plus of those in nursing homes that vaccinated, staff and residents, and I don't think we're there. The nursing home in question, I think only 50 of about 70 residents were vaccinated, which is less than I would have hoped. But equally, we can't force people to have this vaccine. So there will be variations depending on what is said in different nursing homes, I suspect. But we do need to promote it as much as possible, because the people most likely to die are those who are older. And if you've got underlying health conditions, and that is often a lot of people in nursing homes, for instance, they've got a much higher chance. So, look, there's a remote chance, about 1 in a million, you might die from the AstraZeneca vaccine. But if you're over the age of 80, and particularly with underlying disease, your chance of dying is 1 in 10 or 1 in 5 if you get COVID. So, get vaccinated if you're in those higher at-risk groups. And that really means everybody who's a patient in a nursing home. And we need the staff vaccinated, because a lot of the infections brought into nursing homes was, at least last year, via staff.
Yeah, to me, that's been the real failing, where everybody needs to lift their game. As you say, a lot of the people who are patients and were not vaccinated, it's their choice for whatever reason. But there's got to be a big effort very quickly, Peter, on staff, doesn't there?
Well, it does. I mean, it's a bit hard to force anybody to have a vaccine. Particularly, these vaccines are good. They're 90% effective at stopping you dying or getting really seriously ill. But, you can see why people might have some reservations because they're relatively new. But the available data at the moment is they're very effective at stopping you dying, and they also decrease transmission, and reasonably safe compared to all the other vaccines and drugs we've got. I mean, a common antibiotic called azithromycin, which we use for treating infections, for every million people that take that, there's about 14 additional cardiac deaths. That's compared to 1 additional death probably for 1 million people that are vaccinated with the AstraZeneca vaccine.
Yeah, got to keep perspective.
We have these out of proportion a bit, the risk versus the benefit.
Thanks very much, Peter. Appreciate it.
Thank you.
Professor Peter Collignon there again, all over this situation. Let's hope there's good news on the way for Victorians. 1 week is plenty. 1 week is too much, actually, but that's enough. Lift that lockdown.